Coronary heart disease. What is a coronary heart disease? Before you know what a disease is, just focus with me. We go step by step through this name and know each part of it. What is coronary? Coronary, corona? No. It's not related to coronavirus. Coronary are the arteries that are divided, are branches from the aorta supplying the heart. So coronary is the name of the arteries supplying the heart. As we said, that the aorta is pumping blood to all parts of the body, and one of the parts of this body is the heart itself. So it supplies itself by arteries called coronary arteries. So this to make it clear for you. Coronaries are the arteries. Coronary heart disease, the disease is affecting those arteries. So, can we explain the mechanism of forming of a disease in this artery? Normally, the blood goes from the aorta to those branches supplying the heart, so the heart can pump effectively and pump blood to all parts of the body. When the blood reaches different parts of the body, the oxygen reaches our cells, and everything remains in the homeostatic state. But what if this homeostasis is affected? What if these arteries are diseased? Let's explain the mechanism of arterial or coronary heart disease. This is an artery. Normally, the lumen of the artery is wide, so the blood can reach other parts of the body. But when there is something blocking it, partially or completely, the blood cannot reach the other part of the artery, the other part of, or the other side of the artery where it is the heart, because this is a coronary artery, and the coronary artery is supplying the heart. So when it's blocked, the blood cannot reach the heart. Blocked by what? By fatty substances like cholesterol. If you have too much fat in your body, cholesterol will accumulate in the arteries and the major arteries of your body, and forming a plaque, or what is called as atheroma. When they are attached together, they form a continuous layer to block the arteries called atheroma. This atheroma will block the artery, causing blood not reaching parts of the heart. And what if the blood doesn't reach the heart? If this artery, for example, is blocked, this part supplied by this artery will not receive enough blood, will not receive oxygen. And this will lead to something called ischemia. Ischemia will cause symptoms like angina. Angina is the disease. When you have a heart disease, coronary heart disease, your coronary is blocked, and the blood is not reaching the heart or any part of the heart. That means this part is not receiving enough oxygen. That means that this part may die. That means that it will not function in a perfect way. It will not pump in an effective way. And if your heart is not pumping in an effective way, that will not only affect your heart, but it will affect your whole body. It's all about life. Our heart keeps us alive because it remains pumping blood and giving us oxygen to all parts and all cells of our body. So the problem that will result is called angina. Angina is a disease that results from partially blocking the arteries. Angina, symptoms of angina: having a chest pain, very strong chest pain due to ischemia. But this chest pain, the person can have, he does not have it while he's at rest. He will only have it while he's exercising. And why is that? Because normally when we're at rest, maybe we need only this amount of blood reaching our heart. But when you're doing exercise, you need more blood to be pumped to your muscles and heart. So the ischemic effect will be felt and have influence in your heart and body during exercise more than at rest, and this is what is called as angina. That's why you'll feel the chest pain of angina during exercise, not at rest. And if the blockage is not partially and it becomes complete, it might proceed to a more urgent and emergency situation, which is called as a heart attack, where the blood is not reaching the coronary is totally blocked and the blood is not reaching this part of the heart. So that means maybe your heart's not pumping anymore, and the heart attack would result, and maybe this will eventually result in death. That's very serious situation. Coronary heart disease is an emergency that a person should go to the ER and get medication for it. But the question that might come to our minds now, what are the causes of coronary heart disease? There is no real causes. They're not causes, they are risk factors. Risk factors of developing heart disease. There are many factors, as you see here. Smoking, genetic predisposition, age, obesity, diet, stress, physical activity. Those factors together can result in coronary heart disease. It doesn't mean that any smoker will develop heart disease. It doesn't mean that if your grandfather, for example, had a heart disease, you will have a heart disease, but it's a risk factor. It'll increase. The possibility will be higher or increased. Let's go one by one, but before we explain them, you have to know that some of them we have no control over them, like the hereditary or genetic, like age, but others we can work on them and control them. So let's talk about smoking. People who smoke are 2 to 3 times more likely to die from a heart attack. So if you know someone who smokes, please advise him to stop smoking immediately, because smoking is very dangerous for our health. How about stress? As you see, this girl stressed out, and all of us might go through situations or events where we become stressed. So stress can lead to, how stress can affect our hearts. Stress can lead to raising our blood pressure, and raising the blood pressure may increase the rate at which atheroma are formed in the arteries. As we explained in the previous part, the formation of atheroma and the effect of the formation of atheroma and blocking the artery and causing decrease the blood to reach the heart. And if the heart does not receive enough blood, so our body will not receive oxygen, and this will result in a very serious situation like angina. How about genetic predisposition? Coronary heart diseases appear to be passed from one generation to the next in some families. This is not something we have any control over. So this is a factor that has an effect, but actually we have nothing to do with it. But if you have this factor, you should immediately control the other factors that you can control, like stress, diet, obesity, and smoking. Age and gender. As we get older, the risk of suffering from coronary heart disease increase. And about gender, males, they found by statistics that males are more at risk of a heart attack than females. I don't know why. Well, this is a good news. For females at least. What else? Diet. Of course, as we explained in the mechanism of formation of atheroma and coronary heart disease, we said that fat or cholesterol is the one responsible for blocking the arteries. So maybe one of you would think, where can I find animal fats? You can find them in milk, cream, butter, cheese, egg yolk, fatty meat. All these things contain a lot of fat, so you better take few amounts or avoid them if you have other risks, of course. How about obesity? Obesity and diet actually related. Obesity, if you're an obese person, you have high cholesterol level in your body, that means you're more prone of having coronary heart disease. Another factor you should add, which is lack of exercise. Lack of exercise. If someone is not exercising, heart muscle loses its tone and becomes less efficient at pumping blood when exercise is not taken. That's why we always advise people to do exercise frequently, because it's very helpful and healthy because it's very helpful for them to remain healthy and keep their hearts happy. So this is all about risk factors of developing a heart disease or coronary heart disease. But don't be sad, there is always a solution. The treatment of coronary heart disease. There is always a treatment. And if someone had what we talked about and he had risk factors and he was diagnosed of having coronary heart disease, what should I do? As a doctor, I should prescribe for him their medical treatment and surgical treatment. Medical treatment depends on the state of the person. And surgical treatment, maybe if he becomes in a more dangerous situation and he requires, depends on the plaque itself, on the number of arteries blocked and many factors. But for you, you have to know that the treatment of coronary heart disease may be medical or surgical. Medical, using a drug called aspirin. Aspirin, or salicylic acid, prevents formation of blood clots. Always go back to the mechanism. When you know the mechanism, you know how to prevent it, or you either prevent it or remove it, even if it's there. So aspirin, the medical treatment used for preventing the formation of blood clots in the arteries. Because we have blood clots in the artery, we might block the artery, and when the artery is blocked, the same story again, the blood does not reach the heart is not pumping, the oxygen is not reaching our body and our heart, so we might get a heart attack. So to prevent all this, you can, or people are advised to take low dose aspirin, reduce the risk of coronary heart disease. This is the medical treatment. How about the surgical treatment? Surgical treatment, we can use angioplasty and stent. When the blood vessel is blocked, as we see here, the insertion of a long, thin tube called a catheter. They insert a catheter into the blocked or narrowed blood vessel and a wire attached here, and then they deflate it. The balloon is then fed through the catheter to the damaged artery. Once in place, the balloon is inflated. They enter it here, and then when it reaches its place, they inflate it. When they inflate it, they remove this blockage to widen the artery effectively, freeing the blockage. In some cases, a stent is also applied. This is a stent, which is a wire mesh tube that it can be expanded and left in place. They leave it in the heart of a person. So, and plus, those structures might contain chemicals to prevent further blockage. So you're not only treating the problem, you are preventing next problems or unexpected blockage that might happen to that person. So this is the benefit of the treatment. This is the treatment in a simple way. Medical and surgical, aspirin, stent, and angioplasty. This is all about coronary heart